Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hi, I'm Dr. Navdeep. I'm working as a senior consultant neurologist at Indogul Hospital, Noida.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, there's a normal activity which is going on in the brain. Uh, when we are awake, the activity is different. When we are asleep, the activity is different. So, whenever there is an abnormality in that normal electrical activity, it causes a seizure.
What is epilepsy?
Epilepsy, by definition, is two episodes of unprovoked seizure at a gap of 24 hours is epilepsy. So, whenever there is any abnormal activity going on in the brain which causes a seizure, unprovoked means that there is no fever or there is no extreme stress, there is no underlying condition which is causing a seizure. So, that's unprovoked epilepsy.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So, many a times we know the cause, and almost 40 to 50% of the cases there is an unknown cause. Epilepsy can be genetic, which runs in the families. Mother has epilepsy, or father has epilepsy, grandparents has epilepsy, kids or grandchildren can have epilepsy. There can be a trauma in the brain, there can be a tumor in the brain, or after stroke, in older ages, even dementia. So these are the known causes which can trigger seizures in a patient.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So as far as signs and symptoms are concerned, epilepsy, basically there are different types of seizures. There are different 13 and 14 types of seizures. Most common is generalized tonic-clonic seizure, in which there is uprolling of eyeballs, frothing from mouth, tonic-clonic movement of limbs. So that is one type of seizure. Again, this can be focal onset or can be generalized. Focal onset, patient gets to know. Patients usually complain कि हाथ में कुछ झंझनाहट सी होती है या हाथ झटकने लगता है, उसके बाद बेहोश हो जाते हैं. So this is focal onset with generalized seizure. And other types of seizures are myoclonic jerk. It's a sort of jerk-like condition. Absent seizures, in which a person just gets lost. Teachers usually complain that the child is daydreaming. Drop attacks. There are different types of seizures.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Unfortunately, since ages, epilepsy is considered to be a bad thing. कि इसको दौरे पड़ते हैं. Maybe some superstition is there, some bad powers are there which are causing this. So parents or the attendants, they often take them to alternative therapies, babas, and कुछ उतरवा दें उस टाइप से, वो उस तरह की चीजें हैं. Whenever a patient with epilepsy usually enters the OPD, you could make out there's a depressed look. Patients are not comfortable. So it's very important for the doctor and the medical people who are practicing medicine to tell them that it's not a social stigma. It's not something that the child or the patient has done deliberately to themselves. It is something which has happened to them, and the family needs to accept it. Unfortunately, it's still considered a big social stigma in the community.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So, common triggers first. The most common is patients often tend to miss the doses. Patients come to us, we diagnose epilepsy, we start them on the treatment, and patients, they feel कि हम ठीक हो गए हैं, तो हम दवाई बंद कर देते हैं. So that is one of the most common triggers. Then fever, lack of sleep, extreme stress. These are usually the common triggers of epilepsy.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
So at times, when patient gets to know that the patient is about to have a seizure, we call it aura. As I recently mentioned, they feel some abnormal sensation in the hand or some jerking sensation, or they just start feeling uncomfortable. They might feel some heaviness in the head. There are few symptoms which develop before a person lands up into a generalized tonic-clonic seizure in which patient becomes unconscious. So whenever patient experiences that aura, most important thing is that patient should immediately move to a safe place and should lie down. That is the one of the most important things. Then in the surroundings, the edges of the bed or the table, they should be um, covered with some safe rubber so that the edges doesn't injure. In patients, they have drop attacks. Patients, they just fall, or patients, they don't have aura, they just become unconscious, they have a seizure. So whenever a person sees that attendant sees a person is having a seizure, they should make them lie in a lateral position, preferably left side down, and they just need to extend the head so that the airway remains patent. Usually seizures, they subside within 1 to 2 minutes or 3 minutes. So the attendants just need to be relaxed and need not panic. Seizures usually subside in 2 to 3 minutes, and then they should take the person to the hospital. In case if there are recurrent seizures, repetitive seizures, one after the other, then they should not delay and immediately take the patient to the nearby hospital.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Epilepsy is not a social stigma. Please treat it as a normal disease like we have diabetes, hypertension, thyroid. So epilepsy is also a disease like that. So if a person is having epilepsy, one should be compassionate and try to understand what is the cause of epilepsy, and they need to give proper treatment. And there are millions of patients suffering from epilepsy. It's epilepsy family. Doctors are there to support. A lot of people are there to support. So they should just reach out to us in case of any problem.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.